I am the program manager of Connections California Transition to Adulthood, which is one of Parents Helping Parents' newest programs. And you are at Shift from SSI to SSA's Disabled Adult Child program with Daniel Fortuño. Daniel Fortuño is the president and CEO of Benefits Education Center and has 30 years of experience training, counseling, and education in healthcare and benefits administration. As a national expert on disability benefits, he's highly skilled in interpreting public and private health and welfare benefits programs. He has worked in 11 states across the country and has trained and counseled over 20,000 individuals and providers during his career. And he's a very good teacher in case you have seen any of his work before. This evening, we also have joining us from Exceptional Family Resource Center in San Diego, Maura Alberton and Joe Goyos, who will be helping with field some Q&A and perhaps answering any questions about local resources in the San Diego Imperial Valley area if we have anybody from there tuning in this evening. So thank you again for coming to our Connections California presentation. No donation is too small. If you feel compelled to do anything after the presentation, we sure appreciate it. Okay, thanks very much, and I'm going to turn it over to Daniel.
Okay, give me a second to do my, come on, why is it not coming up? Here we go. It helps if I click on it. Okay, am I up? I can't hear anyone. What did I do?
You are not
sharing muted. Yet. Not sharing yet.
Okay, we're going to be talking about transitioning from SSI to SSDI, Disabled Adult Child Program. Let's go over some of the acronyms. I like to do this whenever I do a training. So as I use the acronyms, we're making sure that we're speaking the same language.
So Daniel,
yes.
You're not sharing yet.
I'm not what?
Sharing.
The screen. Oh, Jiminy Crickets.
I think what you did is press the record button. We'll edit it all out. We edit it out in post. Don't worry. There we go.
Sorry about that.
That's okay. We're seeing your whole screen now. So let's just see that. There we are. We are good to go.
Okay. All right, here we go. Transitioning from SSI to SSDI, Disabled Adult Child Program. And as I was mentioning, I'd like us to go over the acronyms so we're speaking the same language. So SSA stands for Social Security Administration. It is not a program, it is the administration. SSI stands for Supplemental Security Income. That's a specific program. And SSDI is Social Security Disability Insurance. Now, briefly going over supplemental security income, because the focus of today's training is individuals that are on SSI becoming eligible for SSDI as a disabled adult child. So to review, supplemental security income, this is a program that has no contribution requirements. Eligibility for individuals over 18, under 65 is disability, and you have to demonstrate need. So the majority of the people that are attending this presentation are familiar with SSI, and some of the details that go into these particular programs I'm going to go over are in our last presentation we did last Thursday. So if you haven't seen that, I recommend that you take the half hour to go through it to help supplement or to give you additional information about this program. This program has liquid assets limitation for an individual of up to $2,000 in the bank, and for a couple, up to $3,000. Okay, let's briefly talk about the SSDI program, Social Security Disability Insurance. What is it? Well, it's based on contributions, and the ways that individuals can qualify for this disability insurance is based on the individual's record individual's record work credits. Sorry, lost English there. It could be given to a widow or widower, and then also the disabled adult child, also known as Childhood Disabled Beneficiary. Please be aware that Social Security might at some point change the name of a program, as they did Childhood Disabled Beneficiary, but pretty much everybody at Social Security still calls it the Disabled Adult Child Program, even though a lot of the literature has the new name that was given. So at the beginning of this, I'm going to use both names, and I'm going to switch to the most commonly used name. So we're going to be focusing on not on the other two ways that an individual will qualify, meaning on their record or the record of a spouse that's passed. We're going to be talking about the disabled adult child, also known as Childhood Disabled Beneficiary. So the eligibility, an individual can be eligible for this particular program if Social Security approves disability after the age of 18 and before age 22, and they have an eligible parent. So the parent either has retired, is on disability, or is deceased. So to get benefits based on mom or dad, they have to be eligible under one of these three different ways. Now, the medical eligibility, this is where often people get tripped up. You have to, if an individual, is on SSI during this period after age 18, prior to 22, you can request that Social Security pull the past file for them to review. They don't automatically do it. And please be aware that it's not uncommon that I have individuals that'll say, oh yeah, my child was on disability before age 22 and after age 18, and then we pull the file and they were age 24. Well, that's not the actual window of time. And then we have to develop the evidence from 18 prior to 22 to get them approved for this particular program. This is why keeping records is really important, and having a good snapshot of medical records of an individual during this time period is going to make all the difference in the world. Now, Social Security no longer adopts a prior decision. So even if an individual was granted between 18 and prior to 22, they do not automatically determine. They still have to look at the record, reevaluate, and make sure the standard of disability was the same or is the same on how the individual was granted. Now, the benefit that the individual is going to be eligible for at mom or dad's retirement is an amount that's equal to half of the parent's benefit at disability or retirement, and at death of the parents, 3/4. Now, when the individual is getting disability or retirement, that is mom or dad, the amount the individual received is not taken out of the parent's benefit. That's what they use to calculate what the benefit the child's going to receive. Now, a couple of important notes. If an individual is DAC and they marry, their benefits will only continue if they marry another DAC beneficiary. So please be aware of this, that, once an individual is on the program, if marriage occurs, there could be a possibility that they could lose that benefit. Also, it's important to note that, and this is not uncommon, a lot of individuals on SSI are encouraged to work, and I don't discourage working, I don't discourage working, I encourage it, but you need to be mindful of what is going on when the work activity is being done. And the reason is that if an individual, before becoming eligible for the Disabled Adult Child Program, is earning equal or greater than substantial gainful activity, they will not be eligible for the DAC program, because Social Security will say, well, they don't qualify under our rules. And there are certain ways that the wages cannot be considered below SGA, or a good way to be able to make sure that that doesn't become a problem if the individual is working, is by staying even lower below the trial work period for that calendar year, which for 2023, as an example, is $1,050. So what I'm saying in all of this is, if the individual is working prior to mom or dad retiring or deceased, there could be an issue that they're not eligible to get the benefit based on mom or dad's contribution if they have wages that are greater than substantial gainful activity. And the way to stay away from that entirely is to keep the wages below the trial work period amount, because Social Security does have the ability to say, well, it's close enough, we're going to call it SGA. Now, one way this can be dealt with, and I have parents that do this, is if there's what's called work subsidy, the value of the wages can be reduced when it comes to the issue of substantial gainful activity. So what occurs is the employer has to be involved. They do a questionnaire. The form number is an SSA 3033, and that form addresses the performance of the individual, the productivity, and an unsuccessful work attempt. If the form is filled out correctly, you can get a reduction in value of the wages as high as 50%. And I've had employers fill out the form and they think they're doing a good job by saying, Johnny can do everything that everybody can do. He doesn't require any accommodations, and they get a zero work subsidy, which has no value, to be able to reduce the value of the wages. So a quick example. Let's say we have Rita, she works at Walmart and she earns $2,000 a month. Well, we know that's greater than the current substantial gainful activity, but she does have a job coach that goes in with her daily. And Social Security, because of the form that the employer completed, grants her a subsidy of 50%, and they're only going to look at $1,000 of her monthly earnings when they're looking at substantial gainful activity. Now, that doesn't mean that any trial work months or any months, where she's eligible for SSI, the benefit will, it will be reduced. But what's going on is the issue of future disabled adult child benefits is not in jeopardy, because the wages are being considered to be under substantial gainful activity. Now let's get more into the transition, actually, from SSI to SSDI. You'll be completing a form, an SSA form, and then of course there's the 3368. Now please be mindful, if you're filling out a 3368, which is a disability report, and you're providing all information that's current, and you're not providing any information from when the individual is after 18 prior to 22, you're going to have a problem. You need to, if possible, provide the records that support disability after the age of 18 and before the age of 22. Please do not assume that a diagnosis alone is going to last the likelihood or the life of the individual. An example, young woman diagnosed at age 16 as being blind. She turned 18. We had to retest her because she's now an adult. So you really need to capture the records. If you have, as an example, a neuropsychological evaluation, which is this elaborate testing that's done that are really kind of the gold standard to get cases granted and show Social Security what's going on with an individual with a mental health disability. If it's done at age 13, they turn 18, there's really not a lot of value in it because it's not current. So that's really important, that you capture or save records. And again, if on SSI during this period, you can request the prior file, and if the laws haven't changed, they should be able to grant it. Now, when you apply for this benefit at the local office, they're thinking the logic of how the program works. They're not going to evaluate the quality of the evidence that you have. So it's really important that you take into account what evidence do I have? How am I going to be able to get this case granted based on the records that we have? Now, the health coverage that comes with the Social Security or the public benefits, sorry, losing English here. The Social Security Disability Insurance Program does have a 24-month waiting period. And if for the individual, for somebody who's a childhood disabled beneficiary and disabled widow or widower. So the benefits are paid after a 24-month waiting period from when they determine the start of the SSDI benefits is. When it comes to Medi-Cal, there are different ways for individuals to qualify. Here are some of the most common, which we're going to be going over this in a future class. 5 different ways that individuals, they're called eligibility category. The one for most of our individuals who are on SSI in the state of California, because there may be people from other states in California, if you're eligible for $1 or more of SSI, and that exists in not all, but other states too, you automatically are eligible for Medi-Cal, and in other states they call it Medicaid, and that will continue for an individual under a provision which is called 1634C as in Charlie. And 1634C, what that allows basically is if it's SSI ends due to eligibility for Social Security disability as a disabled adult child, other than exempt SSDI income, the individual will continue to be eligible for Medi-Cal or Medicaid in other states. So they still have the requirement of 1 house, 1 car. And in California, you need to be below the SSI limits, which now are 130,000. So now that individual on SSI could only have up to $2,000 in the bank, but under 1634C, that individual can now have up to 130,000 and still qualify for the Medi-Cal. 1634C, and I tell people the computer code, it's identification code of 6C. It's not uncommon that you will interact with Medi-Cal and somebody will not be in the right aid code, and it takes a little bit of work, but it can be corrected, but this is the correct aid code number. And with that, we're going to go into questions.